Good afternoon. Allegheny County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department, giving our weekly update on the COVID-19 pandemic. Certainly hope everybody had a healthy and happy Merry Christmas and was able to enjoy time. I know this is a different time than we've always had, and the good news is the vaccine is starting to be distributed and starting to go into arms, and hopefully that will continue at a good pace. I want to thank the health department and their personnel. They've already begun giving vaccine shots to either some of the county employees, some of our health department workers, frontline workers, frontline workers at the jail, at our medical examiner's office and other facilities. I want to thank Dr. Bogan for coming in on Christmas Eve and actually giving those shots with other people in the health department, giving up their time to make sure we get people as vaccinated as quickly and as safely as we can. That's the key. While we wait, though, people going to continue to wear their masks, physically and socially distant, and continue to be safe. We know this weekend with New Year's and people getting together is certainly a time that we normally come together, but we again encourage people to continue to be safe and do the things that they need to do. Governor Wolf, of course, made his the January 4th, the easing of some of the restrictions are going to occur, but just because the restrictions are easing doesn't mean that the virus is gone. We still need to make sure people are wearing their masks, being socially distant, doing the things that keep us safe and keep us responsible. So with that, I want to turn it over to Dr. Bogan to give this week's report and report on where we're going. Dr. Bogan?
Good afternoon, and thank you for joining us again. This is our last briefing of 2020. So our case numbers for the last week have fluctuated due to interruptions in testing over the holidays and delays in laboratory reporting. For instance, yesterday we reported more than 1,000 cases, but many were antigen tests from a few days before that were sort of uploaded into the system in batches. And although some may see today's daily report of about 500 cases encouraging, I again urge caution in overinterpreting a single day number. Our rolling 7-day average of cases is about 570 with a 12.4% positivity rate. These are both improvements from previous weeks, but still quite high. And I'm not sure what the case numbers will look like over the next couple of weeks as more testing resumes and we see the results of any potential holiday surge. We've received many questions about enforcement. Since the state's new mitigation protocols went into effect, the health department has inspected more than 40 food facilities where violations were noted. In many cases, those violations were corrected upon reinspection, and we thank those restaurants and food places for being so responsive. On the other hand, other restaurants have become frequent bad actors and have required follow-up inspections and additional actions. The following restaurants were ordered to be closed by the health department: Piacadillos in Castle Shannon, Carbonara's restaurant in Castle Shannon, Tailgater's Lounge and Grill in Harmer, Al's Cafe in Bethel Park, Il Pizziola in Mount Lebanon, Gianna Via's in Castle Shannon, David's Diner in Springdale, The Cracked Egg in Brentwood, and Bobby P's in the Rough in Penn Hills. The health department's food safety inspectors conduct compliance checks at all facilities ordered to close. If they find that a facility continues to operate, they may seek further action through the courts. The health department has already taken action against The Cracked Egg and the establishments opened as Nerds, The Garage, and Bridges to court. Complaints have also been filed against Piacadillos and Al's Cafe. Let me be clear that any restaurant that is open in defiance of the state's order is putting the health and safety of their employees, their customers, and their families at risk. And the health department may continue to seek action against restaurants that defy the state's order and continue to operate after they have been instructed to close by the health department. I mentioned this last week, and I urge you again today. Please don't patronize restaurants that are defying the state's order or health department orders. There are hundreds of food establishments throughout the county that are doing the right thing, that have closed their indoor dining and have set up thoughtful, safe outdoor seating and that robust takeout orders. These restaurants should be getting our attention, not the few bad actors. Let me turn to vaccines. A week ago, the health department received its first shipment of the Moderna vaccine from the state. Vaccinations started that day and are ongoing. As the county exec said, in the last week, the health department has vaccinated about 500 people, including healthcare workers from urgent care centers, the Allegheny County Jail and Medical Examiner's Office, and research staff working on COVID clinical and vaccine trials. Most were administered at the health department's pulmonary clinic or tuberculosis clinic inside the Hartley Rose Building downtown. I was part of the vaccination team on Christmas Eve day. It was like giving a Christmas present for those who came to the clinic that rainy day. They were appreciative, and I enjoyed being back in a clinical setting. To be able to offer people the first step toward protection was really an amazing experience and one I look forward to again soon. The health department has more vaccines from the state to be administered over the next week. To accommodate this next round of vaccinations, the county is setting up a larger vaccination site. Many of the details are still in the works. We'll keep you posted. One of those details is who will staff the site and any other sites that we may set up. This week, an email went to the members of the health department's Medical Reserve Corps, we call the MRC. The MRC is a volunteer organization comprised of community members who assist in the event of an emergency. Anyone can join. Many have medical backgrounds, but many do not. The health department has used the MRC throughout the pandemic. They are the volunteers that supplemented our own contact tracing team here during surges, and in the past they've helped with our influenza vaccination efforts. We are always seeking new volunteers. There's information about how to register for the MRC on our health department's information page. If you're interested in volunteering, please check it out. All right, and just a few reminders. Again this week, the McKeesport test site and mobile testing sites will be closed tomorrow and Friday. However, the McKeesport test site will be open 9 a.m. to 5 p.m. for testing on Saturday. The health department will again issue a regular daily update on New Year's Eve, but not on New Year's Day. And just like last week, this week comes with the temptation of risky celebrations. New Year's is traditionally a time to gather with friends and family. We remember and mark the year that has passed. We celebrate the good and we bid farewell to the troubles. Please celebrate safely over the next few days. Stay home and connect with family and friends virtually. If you do gather, do so outside, wear masks, keep your distance, wash your hands often, and keep your gatherings very, very, very small, like mostly your family household. To say 2020 has been hard is really an understatement. We have a lot to look forward to in 2021, including the opportunity to celebrate these and other holidays like we're accustomed to. With that, I wish you all a peaceful and restful new year. Thank you for your hard work, your cooperation, your resilience in 2020. You showed once again that we are strongest when we work together, especially if that means staying apart. So please stay safe and be kind. I'm happy to answer any questions.
The first question that we have is from KDKA. Do you have advice for schools that are planning to go back to in-person instruction next week?
Again, I defer really to the state guidance on school reopening, but we do continue to work closely with school districts and support their individual decision-making based on their needs and their population. My personal hope is that schools will prioritize getting our youngest learners back into the classroom as quickly and safely as possible.
This next question is from Public Source. Is the county going to start fining restaurants that continue to operate despite closure orders related to COVID-19 restrictions?
So imposing fines is one of the tools we have available to us at the health department, and we evaluate their use in a case-by-case basis.
This next question is from WESA. Could you tell us what you think of Governor Wolf's announcement about his latest COVID-19 restrictions and allowing them to lapse on Monday is this a wise decision given that cases are expected to surge further due to Christmas, New Year's travel and gatherings?
I think this governor has really done a good job, and Dr. Levine, Secretary Levine, working with health department directors around the Commonwealth, like Dr. Bogan, have really done a good job. And I think it was very appropriate for the 3-week period, which is traditionally a very, very festive hospitality, parties, etc., during pre-Christmas, pre-New Year's coming up. And the governor indicated that they wanted to do, and the secretary indicated that they wanted to have that 3-week period till right after the New Year's as a way to try to calm things down. We're hopeful. We won't know any of that until the next few weeks, because we know that's a lagging indicator. But I think it was appropriate, and I think, echoing Dr. Bogan's remarks, so many of the businesses and so many of the operations, including our schools, have been very, very good about their students and their staff and their teachers wearing masks, staying distant, doing all the right things. And those cases have been very, very minimal in operations like that. And onto the restaurants, yes, most of the restaurants have really, really done a good job and cared about their staff and their customers. There are a handful, and Dr. Bogan enumerated that quite frankly have put their customers and their employees at risk. But not only that, it's not only the employees and the customers that are at risk, they put their community at risk, because it's not just unsafe food that they would be serving that would make one person sick. It's spreading a disease that then can go out and make a whole community sick. So we're imploring people to go to restaurants and patronize places that are caring about you and caring about this community by following the guidelines that our health professionals have said and not putting everybody else at risk.
This next question is a follow-up of sorts to that from WTAE. Is the county taking any measures such as stepping up contact tracing at restaurants whose owners have defied the order, or do you have any concern that these restaurants may have spread the virus because of them violating the orders?
So we follow the same case investigation, contact tracing for everybody. We conduct case investigations. Case investigations lead to a list of contacts, and we contact those contacts. So nothing special is happening as a result of that. We just follow our protocols, and the information about who went to restaurants comes out as part of that process.
This next question is from KDKA. Can you tell us, with the recent COVID case numbers being lower, do you think that's because of mitigation, or do you think that the holiday impacted people getting tested, or is it a combination of both?
I think it's probably a little bit of both. There was definitely an impact. We saw case numbers starting to level out even before the holidays, about 2 weeks after the mitigation orders went in, which is exactly what you would predict. But I also think there's some component in that we did much less testing over the holidays, and again, our testing numbers will go up. Again, our positivity rate's also a little down, so again, a good sign that there was some impact from the mitigation. But again, we'll have to follow the numbers after the holidays forward a little while longer to be sure.
This next question is from WTAE. Can you tell us how many people have received vaccines in Allegheny County to date, and are you keeping track of how many people received the Pfizer vaccine versus the Moderna vaccine?
So the state launched a website today that tracks COVID vaccine administration by county. And I looked at it recently, and it looks like we've given close to 10,000 vaccines for county, and I think it's by county of where you live, not necessarily where it was given, but we've had close to 10,000 vaccines given in Allegheny County, and that will be tracked by the state. So we all use the same state immunization registry system. We report up to that system, and that system is where the tracking comes from. And within that system, the state can run data on whether there is Pfizer vaccine or Moderna. We don't do that at the county level because I track the vaccines I give for the county through the health department, but all the health systems also report into that same system to the state. So it's a long-winded answer, but the data are available, but it's not maintained by us, it's maintained at the state.
This next question is from KDKA. We see that nationwide, the goal of vaccinations is running behind where they expect it to be. Is that the same here locally?
You know, I really can't speak across the state, but I can tell you what we're doing here. You know, I know that people are frustrated that the rollout has been slow, but it also has to be careful and intentional, and you have to have your things set up, and it takes a while to build the systems. So we have seen a ramping up of vaccine administration in our county, both through our health systems have done a really great job at vaccinating their staff and are starting to vaccinate others. The health department, again, we just got vaccine last week, and we've now got a rhythm, and we're getting faster, and our systems will continue to increase. So I'm actually really optimistic. I know there are people out there saying, oh, we haven't given enough. I think after the new year starts, you'll see that the vaccination efforts will really kick into gear, and our efficiency and effectiveness in distributing them will get better and better. And so I can only know what's happening here, but I'm okay with what's happened so far and expect a huge improvement over the next couple of weeks.
And this is the final question from WTAE. Are you keeping track of negative reactions to the vaccines? And if so, can you tell us the numbers, and are you seeing any trends, particularly among the population experiencing negative reactions, if any?
So we know that there's a small percentage of people who will have side effects after getting a vaccination. That's true of all vaccinations. The state and the CDC actually is using a system called V-Safe, or Vaccine Safe, V-Safe. And when you get your vaccine, you're given a sheet of information about V-Safe. You can sign up, it's an app. And what it allows people to do is to put information about those adverse effects. Did they have a fever? Did they have a sore arm? Did they get a headache? Did they get body aches? And how long did those last? It also will allow you to track more serious side effects. And again, that's being done nationally through the V-Safe app. And so that data is really, really important. And I encourage anyone who gets the vaccine to use that system so that we can really find out what is the proportion of people who have side effects. How long do those last? Also, do they help us prevent getting COVID? Because you can still report later if you get COVID at a later date. So again, V-Safe is what's being used. We are encouraging the use of that at the county as well. And everybody we vaccinated so far has gotten a sheet about V-Safe. So it's not us tracking it, but it's being tracked on a national level.
And that was the last question. If there's any closing remarks.
Happy New Year.
Well, let me echo those words. And it almost seems a lifetime ago that we first came before you back in mid-March when we were first learning that this pandemic, this coronavirus was coming here and infecting people. We've certainly learned a lot during that time. As we finish the year, the last one we're doing this year, first of all, I want to thank Dr. Bogan for being willing to help us. She had just begun the job, actually had not even begun the job, hadn't had a start date when she was literally thrown into this issue that none of us could have ever predicted, could have ever foreseen, could have ever thought was coming to our region, to our country. And what she has been able to do with her team coming on board has been so positive for this community in keeping all of us safe, not just the people here in Allegheny County, but throughout southwestern Pennsylvania, and working with Secretary Levine and the governor's office, really becoming a state leader in how we handle this pandemic. And while we've had certainly a bumpy month in 6 weeks or so, I think in many ways we've been able to handle this much, much better than other places around the country. We have a long way to go. We know that. We've got some dark days ahead of us with the high case levels, high hospitalizations, et cetera. We know what we need to do, and it's not about punishing people. It's not about punishing kids who want to play sports or restaurant owners who want to open their establishments. It's about keeping people safe. And I want to thank, the vast majority of people here in southwestern Pennsylvania who have done everything they could to be safe and to keep their families and their communities safe. And we've got, some more work to do. Again, the vaccines are coming. I certainly encourage everybody, if you have the opportunity, when you get called or you get that email or you get that notice at your place of work or wherever you're going to get it, get that vaccine. You're not only protecting yourself, you're protecting your family, you're protecting your community. We know they're going to be working very, very hard, and I want to thank And I'm very appreciative that President-elect Biden has instituted, or is going to institute when he takes office, the Defense Production Act. And I think to ramp that up as high speed, and as Dr. Bogan said, I think you're going to see more and more acceleration and efficiencies, and things will get better and things will get faster as we move into January and into February. And working with all of the partners out there, we're going to continue to do everything we can to make sure we protect everybody in this community so that we can get back to a normal way of life that, has made this region so vibrant and so wonderful. So echoing Dr. Bogan's words, want to wish everybody a happy and healthy new year. Stay safe this weekend, on into the new year, and let's get